This booklet decides how much you pay for health care, who you can see, and what happens when you get sick. But most people never really read it. They skim it. They flip a few pages, they get confused, and then they guess. This is the official Medicare You booklet. It quietly controls more financial decisions than almost any document you'll ever receive. Today, I'm going to show you how to actually use it, the way Medicare expects you to, but never explains. On-screen heading: why this booklet exists every year. Medicare mails this booklet to millions of Americans. It looks harmless, a little thick, a little boring, a little overwhelming. But it exists for one reason: to tell you how Medicare works, what it covers, what it doesn't, and what you need to do next. The problem is, it's written for lawyers, not humans. So most seniors do what makes sense. They ignore it. And that's where costly mistakes begin. On-screen heading: this is a map, not a guide. This booklet is not a guide. It's a map. Like any map, if you don't know how to read it, you'll get lost. The first pages explain what Medicare is, who qualifies, and the parts of Medicare. But the real value is hidden deeper inside: costs, deadlines, drug coverage, plan choices, penalties, rules that only matter after it's too late. That's why this series exists. I'm going to walk you through this booklet slowly, clearly, and in the right order, so you don't have to guess anymore. On-screen heading: the 4 letters that confuse everyone. Very early in the booklet, Medicare introduces 4 letters: Part A, Part B, Part C, Part D. And this is where confusion begins. Because Medicare doesn't explain them the way real people think. So let me translate. Part A means hospitals. Part B means doctors. Part D means drugs. Part C means private plans that replace everything. Every decision you make later depends on understanding these 4 letters. Most mistakes happen because people misunderstand them on day 1. On-screen heading: why seniors get it wrong. The booklet gives you information, but not order. It tells you what exists, but not what to do first. It explains rules, but not consequences. So people enroll late, pick the wrong plan, overpay for drugs, or get stuck with penalties that last forever. None of this is obvious when you're reading, but it becomes painfully obvious when the bills start coming. On-screen heading: how to use this booklet correctly. Here's the secret. You should not read this booklet from front to back. You should use it like a reference manual. In this series, I'll show you which pages matter most, which pages you can skip, and which pages can save you thousands of dollars. We'll go section by section, slowly, in plain language. No sales, no pressure, no confusion, just clarity. On-screen heading: what happens next in the next video? We'll start with the foundation, what Medicare really is, who qualifies, and when timing matters more than anything else, because if you miss one deadline, Medicare never forgets. On-screen heading: download and follow along. I've linked the official Medicare booklet below so you can follow along. Download it, keep it open, and watch this series with me. And if you want Medicare explained simply without sales, fear, or confusion, subscribe. This booklet decides your health care. It's time you understood it.